Director of the Vaccine Education Center at Children's Hospital of Philadelphia and a member of the committee that gave advice to the FDA on the vaccine. Doctor, thanks so much. The number of kids taking part in this Moderna trial is really much smaller than the 30,000 in the adult trial. Is that a problem?
I think it's the only thing that's practical. I mean, the phase 3 trials, the so-called efficacy trials that were done for Pfizer, which was a 44,000 person trial, or the Moderna, which was a 30,000 person trial, were efficacy trials. So half the people got vaccine, half didn't, and then you saw who got sick in the placebo versus vaccine group. Children don't get sick that often. I mean, you would have to do trials that were much, much bigger than that to have an efficacy trial. So instead, what they're doing is so-called phase 1, early phase 2 studies with make sure you got the right dose, make sure you have the right dosing interval, make sure you can induce a response that's consistently at a level that you think is going to be protective, and make sure that at least in thousands of children it's safe. It's really the only practical way to do it.
It's great they're turning toward kids for sure, and rates of COVID infection are dropping, which is fantastic. But does that make it harder to get accurate data? And will the trials like Moderna's take longer as a result?
Actually, I don't think the trials will take very long at all. I think at least the older children are already fully recruited, and now we're moving down to the younger children. I think it's very likely, actually, for children over 12, that we could have vaccines for them by the summer. And for children who are younger, it's possible we could have it by the end of this year or the beginning of next year. And, you know, it is important to vaccinate children. I mean, although they don't commonly suffer this virus, they can suffer it. We had more than 170 children die last year of COVID-19. That's about the same number as die typically every year with influenza, a virus for which we also recommend for a vaccine for children.
That was new for me. Vaccines for kids under 12 by the summer. We'll see. We know that historically a lot of vaccine hesitancy really comes from parents. Are you concerned that too few kids may get this vaccine if it's approved because of their parents?
I think we can reach herd immunity, which is to say 80% immunity, if we can vaccinate adults and vaccinate older children. I'm not sure we're going to need to necessarily vaccinate young children to get to herd immunity. And I think as we get more and more information about vaccines, about its safety, about its ability to protect children, and then I think parents who are reasonably skeptical, I think you should be skeptical of anything you put into your body, will become less skeptical as we get more information. I think that's fair.
Shepard Smith here. Thanks for watching CNBC on YouTube.